So we had a chance to talk about an existential threat that we know has been a long time coming, but we also understand that when you're governing, you don't often have the convenience of ignoring crises that pop up unexpectedly. And of course, the crisis that we're facing right now as a country is COVID, which has illuminated so many weaknesses in our society. For you in particular, what do you think are the most specific weaknesses that have been unveiled by COVID? And what would you do as a member of Congress to combat them?
I believe I'm up first.
Yeah.
Sure. So as a practicing physician at the University of Virginia, I'm in the internal medicine group. And as a hospitalist, we manage the COVID unit. So I take care of COVID patients when I'm working in the hospital. And I have really a front row seat for all of the failures of this response and all the lack of preparedness. Of course, there was a lack of personal protective equipment. Of course, there was an inability to mobilize the ventilators necessary really all over the country. But there was a huge lack of public health infrastructure, which was really missing as well. And so we often talk about kind of the core fundamentals of public health, the blocking and tackling of identification, isolation, and contact tracing. And that's something that we just haven't been able to ramp up and do effectively. Identification through the testing that you need to do to know who's got the disease so that you can identify who around them may also have the disease, and you can really get our arms around a lot of the challenges. We're seeing outbreaks in nursing homes. We're seeing outbreaks in prisons like down in Dillwyn. And I think that for us, we just realized that we weren't prepared from a public health infrastructure standpoint because of the way we've gutted public health funding over the years, both Republicans and Democrats alike. I think the lack of public health know-how, experience, and expertise is really hurting our country right now through this pandemic. And as a professor of public health sciences at the University of Virginia, that's something that I bring in particular to this. So I know every Monday night I do a weekly COVID update where we share good information, because one of the other crises is the infodemic of our president spreading misinformation. And so trying to get good information to individuals, I think, is going to be a key. But moving forward, we have to make sure that we have adequacy in the response, both for individuals, make sure we're testing and we're helping them through appropriately, for hospitals and healthcare systems to make sure that we've got the resources to withstand that second peak that's likely to come our way. And then finally, we've got to keep our society whole, because there's two crises here. There's both the COVID-19 healthcare crisis and the economic crisis. And both of those are things that we need to address really quickly. But on my website, under my priorities, I list kind of the COVID response I think we should lean into.
Thanks very much. We're back around to RD.
I mean, look, this pandemic has really highlighted the need for a public option on our exchanges right away. Part of what we're trying to do, obviously, with the treatment and detection of COVID is to keep it from spreading. And if people are discouraged from testing, if they're discouraged from getting health care, that is obviously the opposite incentive we need to contain this virus and get people back to work. The second big disparity is that all the data will show is that a lot of our essential workers now are people from minority communities that don't have access to this healthcare. So not only are we drawing from a pool of folks who we aren't taking care of, we're putting them more in harm's way. And so even if you didn't care about them, you should want them to have healthcare so that it doesn't spread. You know, this word essential worker is something I've been thinking so much about. And in this country for so long, we've treated people by not making sure they don't have healthcare, by paying them a wage that they can't pay their family. Maybe they're taking 2 or 3 jobs. And that's something we really need to think about as a country. We need to think about that as a party. Right now, who is keeping the lights on in this country? Who is going to work every day? Who is making sure that we have food? Who is making sure that people are getting treated? It's the nurses and the doctors, it's the farmers, it's folks in the supply chain, it's folks at the restaurants around Charlottesville and around the district. So I think this is a good opportunity. Let's look at this as a chance to redefine what it means to be an essential worker, to make sure they have the health benefits they need, and make sure they can have a life here that's pursuit the life of lifelong, the pursuit of life. What am I trying to say here? The Declaration of Independence, life, liberty, and the pursuit of happiness is something that everyone can have.
Thanks very much, RD. John, you'd be next.
The most glaring weakness that comes out of me with the COVID-19 pandemic is the lack and the weakness in leadership, not only from our president, who denied and used it to divide us, but also Denver Riggleman, who has been in lockstep in support of the president. Absolutely no leadership and no courage there whatsoever to stand up against what was clearly an awful response that puts us really behind some third world countries, or what we refer to as third world countries, in the way we've responded. we have relied on PPE from countries that may not necessarily have our own best interests at heart. One of the reasons our response was so slow was because there was no coordinated effort. We had the talent and the treasure to do it, but there was no coordinated effort. And we needed to have that. And that was probably best done through the logistics capabilities within the United States Army. We were manufacturing masks and gloves and gowns and ventilators all overseas. Let's bring that back. If we're going to have a second wave, let's onshore and nearshore some of that manufacturing. It will create jobs. It will get some of our 40 million people back to work. Senator Michael Bennet has a wonderful plan that he's talking about with a health corps. Let's train young people 90, 100 hours to go test and track and get out in front of this next wave of the pandemic, which was clearly the strategic planning around that was an awful weakness. We can also, I think another weakness that has shown up here through COVID has been rural broadband. I know we'll probably talk about that more, but the fact that we don't have that affects directly telehealth, which has affected health outcomes by rural citizens in the 5th District.
Thanks very much, John. And then Claire, you would close us out.
So, the president has likened COVID to a war. Having prepared to go to war multiple times in my life, I can tell you that he did exactly the opposite of what we're trained to do in the military when you're getting ready for a war. My job as an intelligence officer was first and foremost to train my team and make sure that they had all the equipment they need to be able to carry out their mission during that fight. We have a serious logistical problem in this country, and it has to be addressed. But beyond just the preparation, there is the consulting of experts. As Cameron mentioned, President Trump fired the experts who could have provided him with the sound advice he needed to frame a response, even with the weakened logistical system in this country. So consult experts and being prepared is absolutely critical. The logistical system needs to be in place such that our doctors can focus on actually healing and addressing the medical emergency as opposed to procuring the PPE. But this is beyond this being an issue of logistics and a horrific lack of leadership. The inequities that were highlighted here are absolutely have to be central to the way that we recover. I mean, we're talking about the inequities in our society, and we're looking at a health crisis that has inordinately affected, disproportionately affected communities of color. What's happened to women who are in, dangerous relationships and threatened by domestic violence in this time. We have to address the inequities that have become so clear in the face of this pandemic.